Over the last few weeks, staff from the State House Health Monitoring Unit have been combing in Bukedea for a monitoring exercise of health service deliverer in the district. In one of their findings, the team found several health facilities across the district are operating with a skeleton staff, forcing existing staff to work extended hours and handle an overwhelming patient load. The strain is contributing to staff burnout and impacting on their ability to provide adequate attention to individual patient needs.
The Bukedea District, I think, is one of the districts with the lowest staffing levels. Using the old structure, there were less than 40%, the staffs available, and it becomes worse with the new staffing structure. Maybe they may be hovering around 25% or even less. So there is really need for more staff to support these facilities, and indeed patients are there.
Furthermore, the district aging infrastructure and incomplete buildings are not commensurate with the rapidly growing population of over 288,000 people.
There are many buildings which have come up. They are due for completion. I think they are over 90% done, although some of the fittings need to be adjusted.
In Kachumbala Health Center 3, which is currently being upgraded to Health Center 4, is among the health centers choking with a high number of patients per day. Dr. Caroline Kiai, the in-charge, says she receives an average of 150 patients per day, tearing her apart.
So on average, we have between 150 to 200 patients as OPD clients. And then antenatal, we have the biggest antenatal coverage. We have very many young mothers. On average, on antenatal, we can receive about between 200 to 250 mothers per day for antenatal. Our monthly delivery is between 100 to 150 mothers per month.
Dr. Kiai says she has to juggle around outpatient department and the maternity as her daily routine.
I normally have to see both clients, both from OPD side and then the maternity side. And then also the work overload. Sometimes I really feel overwhelmed. You're the administrator, you're the clinician, you're the consultant, so you're almost running everything.
The health center has only 7 medical staff on government payroll and a few other volunteers serving a population of over 28,200. With no essential equipment, reliable electricity, Kiai is forced to use dim rechargeable lamps to deliver mothers at night when electricity goes off.
We don't have a backup solar system and we don't have a generator. We are actually using the rechargeable electrical lights. Rechargeable electrical lights in the case of a power blackout, which is quite frequent here. So the theater is not yet operational. But for all emergencies and referrals, I have to verify and see them.
Dr. Emmanuel Odeke, the district medical officer, says he's calling for urgent intervention from the central government to address these critical challenges, increase funding for healthcare, infrastructure. He adds that his office is trying, amid its high budgets, to recruit more staff.
We actually have 14 government facilities, 2 health center 4s, that's Bukedea Health Center 4 and Kachumbala Health Center 4. Then we have the health center 3s, which are 9. But now we are trying to make sure that we implement the new structure slowly with the wage that's available, and we are at about 30% with the old structure.
The situation in Bukedea District highlights the significant challenges facing Uganda's healthcare system, particularly in rural areas. And without immediate and decisive action, the health and well-being of the Bukedea community remain at a serious risk.